What if you had surgery and nowhere to recover? What if your medicine needed to be refrigerated, but you had no fridge? What if you finally got housing, but are struggling to deal with health issues without support? This is a reality for thousands of people experiencing homelessness. At Fred Victor, we believe health and housing aren't separate, they're inseparable. We found that the most effective way to support our community is to bring the services to them, directly where they live. Our latest social medicine initiative is a partnership with University Health Network to open Dunn House, a first-of-its-kind partnership between a housing provider and a hospital. For the first time in Canada, doctors prescribing housing as treatment for homelessness.
I think the thing that's really unique about Dunn House is that housing was created, but the medical supports were put inside the housing rather than expecting somebody who's newly housed to make it back to the clinic for their follow-up appointments. It's quite life-changing for people. It means that people get connected to those appointments. They attend their follow-up. They make connection with primary care. They get psychiatric care and full wraparound services where your healthcare and your housing provider are working together to improve your quality of life.
So I was one of the first to move in. I spent 6 years homeless prior to this. 1 year alone, I spent around 131 days in the hospital. I basically had to fight for myself to survive every day for that time. So I think a lot of people have this view of homelessness as people that always didn't try and always didn't have a chance. And that's not the case. I had a successful job and I was a family man, got university and college diplomas. There's a lot of people that are homeless in the street have come upon hard times, and that's just something that they've been faced with. Even getting somebody's attention to really start the ball rolling on helping you is extremely difficult, extremely long. Navigate through the systems and the hurdles you're going to face is challenging.
I believe that housing and health are innately connected. I believe you can't have housing without health, and you can't have health without housing. In a lot of ways, it's like the social determinants of housing rather than the social determinants of health. Housing is a human right. And without housing, a woman in Canada, average life expectancy is 36 years old. Sit with that number. An unhoused woman lives only till average 36. But it's time to acknowledge that housing is a human right and is part of healthcare.
We fundamentally believe that everyone deserves human dignity and respect. We've been practicing social medicine for decades. We know that health starts with housing, and with the right supports, people can rebuild their lives. We see it happen every day, but we can't do it alone.